So one of the first topics you'll learn in clinical skills is something called history taking, and that's essentially just learning how to talk to a patient and get information from them in terms of why they've come and what their past history is like. So the key part of this is that you always start with a really broad question like why have you come in? Like what's brought you into the doctor today? Or um, why have you come to hospital? Or what's been troubling you? Like any of the above is fine. It doesn't need to be specific wording. It can be really anything. And there's going to be a lot of like different ways this is taught, and it will vary from university to university, but there will always be a structure which is taught. So a really common one that I went with because it's probably the most common one which is taught is Socrates. The one that's actually taught at Monash is not Socrates. It's like WWQQAA BIC. So it's a little bit different. And that stands for like where, when, quality, quantity, associated features, alleviating, aggravating, beliefs, impacts, um, concerns, and expectations, right? So that's kind of the model that we use. And it's fine to use either, like it's fine to use any model you want, but Socrates is probably the most famous one. So I thought I would just go with that one because it's probably the one which will come up the most. So it's very pain focused, unfortunately. But you can apply it to things which are not pain related. So first thing, site. Where is the pain? Like, where is the symptom? Like, say this person's like, oh, my leg hurts. Oh, sorry, that was definitely not your leg. Definitely not the leg. Let's say, oh, my arm hurts. Oh, it hurts so bad. And then you can ask them, or let's just say it hurt. Like somebody says it hurts, right? And then you can ask, where does it hurt? You can say, oh, my arm hurts so bad. Um, and then you can say, can you point to exactly where the pain is? And that helps localize exactly where the pain is. Because people might say, oh, my pain is here, but that doesn't really give you much information. Okay, onset. That's talking about how the symptom came on. So, for example, if we're talking about nausea or vomiting, we can say, did you suddenly like feel really nauseous or was it kind of building over a couple of days? When did it first start? Is it on and off, right? Then character. You're talking about like how would you describe this pain or how would you describe the nausea? How would you describe your tiredness? So just ask them to describe it. Radiation is to do with the pain, normally pain, like does it go anywhere else? So let's say my arm pain. Oh yeah, it goes to my hand as well. I get some like weird sensation in my hand, or my shoulder hurts as well. Like that's a radiation because it's coming away from the main pain source to somewhere else as well. Associated symptoms. So that word is terribly, terribly vague, but essentially what it is like, let's say I said I have my arm pain, and I said you say to me, "Oh, is there any other symptoms that you think you've been having?" And especially when you're beginning, people will be nice, and if you ask that, they'll be like, "Oh yeah, I actually did have this. I have some numbness, I have some weakness, etc." T for timing, and that's to do with like has it changed over time? Has it increased? Has it decreased over time? Exacerbating and relieving. So that's kind of like um, aggravating and alleviating, right? But what makes it better? What makes it worse? Severity, what you need to say to them is you can say, just rate it on a scale of 0 to 10. What we were taught is that you must tell them what 0 and 10 is. Because you might say, okay, what's 0 to 10? And they might be like 10. And you're like, so it's the most painful thing you experience. It's just like, no, I mean a 5 then. So you just need to tell them what 0 and 10 is. So 0 is no pain, or 0 is, say, this was for like vomiting. So or like for nausea, like 0, not nauseous at all. 10, you feel nauseous every moment of the day. You feel like you want to vomit, you have vomited, etc., etc. So that's kind of the idea of it. And Socrates is like forms the main presenting to play. So why they've come in today, right? But then because a patient is a person, not just a problem, right? You need to find out about what's going on around them as well. So things like their smoking history, their alcohol, what medications they're on, what medical conditions they've had in the past, their family history of medical conditions, what their social life is like, and whether they exercise, what they eat, if there's any sleep problems, if they've been stressed more than usual, what are their finances like, what's their occupation. So you can find out a lot of things, and so that you can get a bigger idea of that person, because we can go back to that idea of social health and that things around the patient also impact the patient. And a lot of the things like past history, family history, and the smoking alcohol stuff will also impact the types of diseases you might see in the patient. Cool. So, um, let's we've got a couple like couple more slides, but essentially, let's just talk about putting it all together. So that's kind of like each little individual bit of content, and now let's talk about what you might see. So many universities will have case-based tutorials, lectures, big workshops like I've talked about before, and they try to have lectures which are based on the week and have like essentially a topic of the week or a system of the week or a body part of the week. And what they do is they talk about that body part and then they base tutorials or big workshops on it. And normally it's designed so that everything fits together quite nicely. Some universities do it better than others, unfortunately, and some will have lags, but that's okay. Like ultimately you have to learn everything anyway. So an example of a week of curriculum which fit together very nicely was we had a week which was focused on heart stuff. So we had a lecture on heart physiology, so how it beats, how it starts to beat, how it stops beating, etc. Um, then in our anatomy classes, we had dissections and looking into the heart and thoracic region and all the nerves and vessels that pass through there. Then our clinical skills was based on taking a heart history, so all the heart symptoms. And the following week was focused on doing a heart exam, so listening to the heart. And then our kind of med law and ethics and social and population was kind of focused on scenarios and interventions for people which are heart related, like doing ultrasounds of the heart, doing scans of the heart, and also how to consent patients and the idea of informed consent. Cool. Okay, so this is the part which I am very, very excited about. So hopefully you will all find this a little bit fun because I feel like this will be quite fun for everyone to do. So hopefully everyone can just ask questions. The questions are asked anonymously as well, so it'll be a lot of fun. But essentially, so let's go back to that Socrates process again. And I can, I'll maybe, hopefully you guys can access both of these at once, but maybe I'll feel like it'll be easier if you can see the wording around it as well. Maybe I'll just do this. Oopsies. Give me 1 second. I feel like it'll be better if you can see everything. So, okay, move it into here. Okay, I'm gonna do that. I'm gonna just make the text smaller. Okay, let's try that from here. Okay, so hopefully you can see that all. I just feel like it'll be easier if you, yeah, if you guys have the answers, oh sorry, just like the acronym as well, because it'll be easier to ask questions. So normally this occurs in small group tutorials. I feel like this will be really fun to do. So let's do this question in Slido. So we have Mr. Cup. He's a 68. This is a really common type of question. This is probably the most one of the first types of like patient scenarios which you'll learn. We have Mr. Cup. He is a 68-year-old man who's come in to talk to you, his doctor, and to ask some questions. So, what is the first thing that you want to ask here, according to what I've been saying so far? So you can just put it into the Q&A because I don't think you'll be able to. Oh wait, I have a poll. I lied. But if I go to the poll, you can't see it anymore. Let me just activate the poll and then you can input the answers. Um, this one. Okay, what questions would you like to ask? That activated. I realized it didn't activate the other poll, so sorry. Okay, what questions would you like to ask? Okay, I'll go back to the other page so that you can, while you're typing, you can see what the questions are as well. Perfect. Really, really, really good. Okay. So where is the location of your cane? Point to it, please. Okay. So I'm gonna say, okay, doctor, yeah, I've just had this horrible, horrible, horrible chest pain, and it's just not going away. It's in the middle of my chest, so right here, I would say, but it's just so bad. Okay. All right. What other questions do you want to ask? Yeah, beautiful. So one of the questions that has been asked is, has it subsided at all? Like, has it changed? What's been going on with it? Yeah, so doctor, I reckon, yeah, that I used to have this pain as well, like, but it never used to be this bad. I used to have just a little bit of pain. I used to get a little bit uncomfortable, but it just went away when I sat down. Like, I was completely fine. But now, doctor, this has not gone away. I'm in so much pain. I feel like the world is ending. I'm feeling sweaty. I'm feeling hot. Like, I just cannot do this. What some other questions that you might want to ask? Has it what has eased your pain? Really good, exactly. Oh yeah, doc, nothing has really made it better. Like, I feel like an elephant is sitting on my chest right now. I just cannot deal with this. It's seriously so bad. Nothing is making it better. Nothing is really making it worse either, but like, I am in so much pain. Maybe we'll get. Yeah, perfect. When has the pain come on? It's kind of bright. Oh wait. I cannot read. Perfect. So if so, often, let me just say, so where is location? We've done that. Does when has the pain come on? Oh, doc, it came on like an hour ago, but it's so bad. Like, I swear, it's the worst pain I've ever experienced. Um, what habits, what habits do you have? Or what habits? Oh yeah, funny that you asked. Like, I do not go outside. I'm on my couch all the time. I just sit there, do nothing. Um, Doc, I know it's bad for my health, but like, I just cannot get up. Okay. All right. Do you smoke and drink? Perfect. Really, really good question. This is really important for this type of patient, right? Actually, Doc, you know what? I do smoke. I've been smoking for a number of years now. I've smoked since I was 18 because everybody did back then. And I smoke like 20 cigarettes a day. I just, I know it's bad, but I just can't quit. I do drink a little bit. I drink like a glass of wine or two with my wife at night. But you know, other than that, I don't drink that often. But I feel like I don't drink that much, I would say. Okay. All right. Any other questions? You guys are doing so amazing. Um, this is exactly the questions that you should be asking. Okay, so we've covered site, we've covered onset, we've carried character. I said an elephant is sitting on my chest. Um, we've covered timing, whether it's getting better, covered exacerbating, alleviating. What other things do you want to ask about? So really good. We've also had one on how severe is your pain? Perfect. Oh, doc, like I said, pain is 10 out of 10. I cannot deal with this. Seriously, I've never experienced this level of pain in my life before. I just, I need something to help right now. I just feel absolutely awful. Right. Um, is it 10 is unbearable? Perfect. Really good that you quantified it. What is yours on a scale? Perfect. 1 is noticeable, 10 is unbearable. Yes, absolutely, really good that you guys are quantifying what's going on. Because once you quantify things, it just helps you kind of understand what's going on a little bit more. So yeah, I would say it's a 10. Out of the scale even, I would say it's 100. It's just so bad. I feel just so unwell right now. So we've done one, two, three, four. Okay, so I'll give you all the last couple of details and you can try and tell me what you think is going on right now. So I say, oh, it goes up into my jaw and down my left arm as well, like in terms of the pain, just a little bit. It's not as bad as my chest pain, but it does a little bit. Uh, and then timing, it was really suddenly come on, like just bam, and then I was just in pain. Like nothing makes it better though. I am so done with this pain. Uh, associated symptoms. I feel a bit dizzy. I feel a bit sweaty. I feel a bit puffy. That's how I feel right now. Yeah, and I feel also a bit faint. So I don't really know what's going on. Cool. So I'll give you also some other information about this patient. So they've had a blood pressure. They're on blood pressure and like kind of cholesterol medications, which are things that are like fats in your blood. Has been stressed lately. Like I said, I don't exercise, I don't really do anything. And his father had a heart attack at 70. His mother had high blood pressure, no siblings, no children. Okay, so what do we think is going on with this Mr. Cup? What does it sound like based on kind of like generally what you think this sounds like? Yes, perfect. Exactly. Cardiovascular disease, right? This sounds like something very heart related, very something. So I'll just show you this. And well, there is actually a couple more slides. Sorry. So this is just an ECG, which is that heart electricity. Do you see all these like jumping up bits here? That's not normal. That's something we call ST elevation, which is basically elevation of this region here. And that's not good. That indicates that he's having a heart attack of some sort. So definitely not very great. But you'll see these a lot more as well. Okay, just some fun.